The following education video will cover the adult patient profile through navigation and documentation. Accessing the note. You will access the adult patient profile by choosing your patient first. Then in your main toolbar, locate the icon that states Enter Document. From here, in the search bar, type Adult Patient. And once you have found your selection, you may double-click on this or choose Open at the bottom of your screen. We will now go over navigation and documentation. But first, let's take a look at the policy and our documentation requirements. These are based on the Med-Surg and critical care standards of care. This note will be used for inpatients only. The exception is if an observation status patient is on an inpatient floor, they will use this note as well. Only one note per patient visit will be used. The adult profile must be completed in 24 hours, and the significant indicators must be completed within 24 hours. This note must be complete in documentation unless there is a pertinent patient reason, for example, a coma, there is no family, or any other reason. When the note opens, you will see on the far left-hand side that you have a sections option. Here, I like to refer to this as a table of contents and will let you easily navigate through your note to make it more efficient. You will see a header titled Significant Indicators with a little blue icon next to it. Anything with a blue icon is the content that needs to be completed within 24 hours. Even though there is a 24-hour time frame on this content, typically it is done pretty quickly as this is the admission record for the patient's stay. The first thing that we will go over is the copy forward function. This note will allow you to pull in prior data from another visit. It is important, however, if you use this function, that you are very thorough with your review. When the next screen populates, you'll be able to choose the appropriate document you wish to pull information from. Be sure to choose the most recent date. Once you single click on the title of that document, the information will pull. On the far right is the information that was documented from their last stay, and in the middle is how you will manage this information. You can use the addition signs to expand, and then from here, as you go through and verify the information on the right, you can check off in the middle what you have verified. It is important to review this at length and be as thorough as possible. Once you have chosen all the information that you need, you will choose the Pull into Patient chart at the bottom right. Once you pull the data in from the note, you will be asked for a validation. Here you will click into the Yes option. As we move through the note, you will see that there are some links that can be used. For instance, you have your allergies link that will allow you to enter any allergies or intolerances that you need to. Moving a little further down, you will see some significant indicators, and then also a link for your OMP, or Outpatient Medication Profile, which is the same as entering some home medications. Both of these can be used during the admission process. We're now going to take a look at the general information, significant indicators, and take a look at the functionality. If you see when you hover, it says that there are 15 significant indicators. When I click into a field, you will see that there is a blue highlighted area, which is our location within a note, and also a clock that allows me to enter real time. Moving down, if I look at the preferred language that I've chosen, English, it's a square button which allows me to enter more than one option. For my next selection of yes, in the currently receiving home health services, there are 3 dots, which is an ellipses. Basically, this means that once you choose that selection, another field or fields will open for you to further document towards this topic. You will note that as you are documenting against significant indicators, once you enter that field, the icon now goes away. If we take a look back at the sections area, you will see that if you hover, it will start to count down for you. Patient belongings can be documented against on the patient's admission. We have an advanced directive area where you can document whether or not the patient has one, or if they'd like to formulate one during their stay. Medical decision maker. You will document to their living environment any substance use or smoking. If we take a look at the smoking status questions, if the patient is a current smoker, you will get a notice or an alert that requires you or suggests that you ask the physician for a nicotine patch. And from this answer, you will need to enter more information regarding their smoking status. The same thing applies for substance use, depending on your selection, whether it's alcohol or street drug. When you make that selection, other areas will open up to allow you to document a little bit further. We will now look at both the acute and chronic pain assessment. They are actually both the same data entry fields. However, one will be an assessment of acute pain and the other will be chronic pain. So fill this in as accurately as possible. We also have various screens within this note. We have our nutrition initial screen and also our malnutrition initial screening. The next area has to do with reproductive, female, and basically it will ask you a very obvious question based on the documented sex of your patient. So if the patient is a female, it's going to ask you, are you sure? Once you answer yes, you will be able to document the pregnancy and breastfeeding. If your patient is a male, it will say, is your patient a male? And you will say yes, and you will not be required to document anything. We will then address the current functional level, an abuse screen, and your mental health assessment. Your mental health assessment will be required based on your answer of yes for either question. You will need to continue your assessment by choosing in the behavior disorder. So you will simply place a check mark in the next field, and another area will open. Here you will need to document your patient, observations. Anything from the selection of hostile on will require you to document to a SAD person's assessment. The SAD person's assessment follows right below, and you will answer each question according to your patient's assessment. You may then document to the values and beliefs, any blood transfusion restrictions, and then also a learning assessment for the patient. We will now discuss the first degree family health history significant indicator. You will access this area by clicking into the little icon under this header. From here, on the bottom left-hand side, there is a little subheader for family history and then a folder that says first degree. Once you click into this field, you will find all of the options available. We do need to ask the patient if they have any history of coronary artery disease, cancer, hypertension, or diabetes. If the patient has no pertinent family history, you will choose the Add button next to that selection and choose both mother and father, because you are saying that neither one of their parents has any issues on either side. If the patient does have a family history of any of the medical diagnoses that I described, you will simply click on the Add next to Family History of and choose the appropriate family members. Remember, this is first degree: mother, father, sister, brother, son, or daughter. Choose the OK button, and it will populate to the top of your screen. If you need to modify or add to it, you can simply click next to the Add button, again, next to the same type of medical history, and add a family member. We will now discuss standardized procedures. There are 3 standardized procedures that we screen on admission for all patients. We have pneumococcal, influenza, and MRSA. Based on the first question, either a new field will populate or you will stop at that point. So for example, if I choose yes, that the patient meets the criteria, you will now see there is a red icon that populates that is a mandatory field. Basically, you cannot move past or save your documentation unless you answer these questions. So you will choose the indications and contraindications for the patient for a pneumococcal screening. The last question asks if the patient meets the indications. If the answer is yes, this will not place the order for you. It's simply reminding you to go place the standardized procedure order. We will now discuss the remaining details of this note. We will start with admission education. For a more detailed explanation on documentation of education, please see the education outcome flowsheet video. Here you will have 6 points of documentation on admission. The first is your pain and pain management, what you educated to, who you educated to, how you educated to, and whether or not they understood. We will talk about fall handout and the education behind that. There is a video, there is all kinds of education. We will talk about room and unit orientation, so be sure to tell the patient where they are, how to call you, what their room number is, and so forth. These are both points of education that need to be checked. We have our family activated rapid response. Again, you will want to place a check mark in both line items. We have our hygiene and infection prevention, so hand washing, gelling, personal hygiene, oral care, and so forth. Keep in mind that you are not only teaching that your patient understands this, but you can teach family members, guests, and so forth. And the last one is the isolation. So if the patient is on isolation, you will want to educate to this. If they aren't, on the very far right, you will see that under the instruction review code, there is a not applicable. So you may go ahead and choose this option if the patient is not in isolation. Next, you will have an order entry icon. In this field, you can enter either orders that are currently being obtained, or you can use them for your standardized procedures so you don't forget to enter them once you exit your profile. Lastly, we have our health history. This is often a hidden significant indicator. This is not a head-to-toe assessment, but simply a review of systems. The way this will function is that you will go down the system list and ask the patient if they have any history of any of these issues within the system. For example, if the patient states they have cardiac issues, you would simply highlight the cardiac and choose the appropriate diagnosis or medical issue that they have. Document as thoroughly as possible. Based on some of the selections, you may have another field that will populate. If there are any other issues, for example, endocrine, maybe the patient is diabetic, you will then simply click into that body system, choose the appropriate selection, and document all of the points that are needed. Once you have entered all the data, you may use the Save option at the bottom of your screen. If you are not complete with this document, you will get an alert that basically states that this document is incomplete as of now. Do you want to submit it as incomplete or return? Keep in mind that you can return to this note as many times as you need to within the 24-hour period to make it complete. We will discuss modifying a note next. We will now discuss modifying a note. If you had to save your note without it being complete, or you need to add to your note, you will simply access that note by choosing the correct patient and then the Documents tab. You will need to locate the note that you started. It's easiest if you collapse the headers and then separate out by clinical documents and then your profile. You will simply right-click on your note and you will have an option that says Modify Document. From here, you will be able to access the note that you prior worked on, and once you've entered the information, you will simply save it. We will now discuss canceling a note. In the event that you documented on the wrong patient, or you need to cancel the note for whatever reason, you will then need to find the patient, open up the Documents tab, locate the patient profile header, locate the note that was incorrect, and simply right-click. Here you will see the option to cancel the document. Once you choose this option, another box will populate. You will need to enter a reason as to why you canceled this note. There is only one, entered in error. So choose this, choose OK, and you will notice that there will now be a line through that document that was prior entered. This will conclude the education on the adult patient profile.